Breaking right now, Mayor Lori Lightfoot and other officials at City Hall with a press conference about the coronavirus. Let's listen in.
For novel coronavirus here in the city of Chicago. The patient is a Chicago resident. She's a woman in her 50s. She is currently hospitalized and in stable condition. This patient recently disembarked from the Grand Princess cruise ship, which is off the coast of San Francisco. She disembarked on February 21st. She returned home to Chicago a few days later. And on March 4th, the cruise ship made an announcement that there had been initial coronavirus cases associated with the cruise ship. There now have been more than 20 positive cases associated with this cruise ship. When the patient returned to Chicago, she did return to her place of work, which is Vaughn Occupational School. In the setting, out of an abundance of caution, we've been working with Chicago Public Schools to make sure that we have a clear plan to reach out to students, families, and employees at this school. In addition, the Chicago Department of Public Health is reaching out and finishing a full investigation of this case. We will be speaking with her in detail to understand her movements, to communicate with anybody who may be at risk in the Chicago area, and to ensure that we conduct a full investigation. I think with that, I will go ahead and turn it over to the mayor, and then at the end, I'll be able to answer additional questions. Thank you.
Thank you, Dr. Arwady, and I also want to thank Governor Pritzker for being here with us, and also Dr. Jackson. As you heard from Dr. Arwady, we just have a case of another presumptive positive for coronavirus here in Chicago. As Dr. Arwady mentioned, the patient works at CPS. She is a special ed classroom assistant who is now hospitalized and receiving treatment. I want to reassure all of our CPS students and families that our city has been working relentlessly to protect the safety and security of our students, faculty, and staff, along with their friends and loved ones. In response to the situation, city officials have already begun an extensive, comprehensive outreach effort to connect with CPS families, staff, and personnel, and that effort will continue. We will continue to do so over the coming days. Now, despite this case, I want to remind everyone that the risk to the general public still remains low based upon the advice and guidance that we received from our public health officials. Over the past 2 months, our team has done really an outstanding job to remain proactive in addressing this situation. As you heard the governor and I and Dr. Ezike and Dr. Arwady talk about just a week ago, we have all been working together seamlessly at the city, county, and state level, and we will continue to do so. We have several local hospitals to expand testing with people with respiratory symptoms in an effort to diagnose new cases as quickly as possible. And as I mentioned, we continue our ongoing efforts to anticipate and be ready for any additional circumstances that warrant additional resources or attention. Our teams are working well together. We continue to have a detailed and comprehensive plan in place, and we stand ready to add any additional resources as necessary to make sure that we are addressing any needs of the public in this moment. I'd now like to invite Dr. Jackson to the podium to say a few words. Dr. Jackson.
Thank you, Mayor Lightfoot. Our highest priority as a school system is to ensure the health and safety and well-being of all of our students and staff at CPS. As you've heard, we have a confirmed case of coronavirus at Vaughn Occupational High School. At the advice of CDPH, we will be canceling classes at Vaughn Occupational next week, as CDPH performs a protocol to assess any individuals who may have come in contact with this employee. It is important to note that Vaughn is a unique school with many complex needs. As a specialty school for students with special needs and disabilities, we want to take all possible measures to ensure that the health and well-being of these students is the first priority in conjunction with CDPH. While I understand that parents across the district may be concerned by this development, I want to stress that this is currently an isolated case. We would also like to remind people that we are committed to continuing timely information as this situation develops. We also want everyone to know that the district has developed a cross-functional team led by Dr. Fox, who is here with us today, our Chief Medical Officer. This team is responsible for assessing the situation in conjunction with CDPH and planning for any contingencies as the need arises. I also think it's important to note that we have sent out several communications, and we have a comprehensive set of guidelines for staff and students to avoid more transmission. First, we're asking all staff that are coming from one of the locations that have been identified as level 2 or 3 to self-quarantine themselves by staying home for 14 days after returning from those locations. We also want people to understand that while this is a virus that is spread by airborne, our facilities department has pre-ordered additional materials such as soap, disinfecting solution, surface wipes for high traffic areas, as well as hand sanitizer. We have also redistributed signs around common sense measures such as washing your hands and how to do that in accordance with CDC and DCPH's guidance. We're also working extremely closely with CDPH to continue to work directly with the families at Vine, and we will continue to keep the entire district updated as needed. At this time, I want to welcome Governor Pritzker to the podium for other updates.
Thank you, Dr. Jackson. Thank you. Thank you to the mayor as well. Good evening, everyone. I want to thank the director of the Illinois Department of Public Health, Dr. Ngozi Ezike, who's joined us here, Mayor Lightfoot, the commissioner of the Chicago Department of Public Health, Dr. Allison Arwady, for their leadership, and for the many, many individuals, frankly, that are working behind the scenes day and night to contain this virus and to prepare for the potential of further spread. Throughout this process, I've made it clear that we will communicate with the public and the press regularly, responsibly, and honestly. The unknown, frankly, can be scary, and I believe it's crucial to give our residents all the facts and best health practices so that they can protect themselves. As a parent myself, I understand how unnerving this information might be for many of Chicago's residents, but I want to be clear, in this case, as in every case, the federal, state, county, and hospital level public health officials are working to actively identify any individuals who came in contact with this patient. As of today, we have launched the process of individually contacting and interviewing children and parents who may have been exposed. We will ensure that they get any medical support that they need, including testing and medical care. I want to emphasize the strength of our public health system here in Illinois. We were the very first state in the nation able to test for COVID-19 because we knew to press for that capability. And we now have 3 testing labs, one here in Chicago, one in Springfield, one in Carbondale, all with the ability to run these tests. Our state has been held up as a model for the nation. Dr. Ezike testified in front of the United States Congress Wednesday about our approach here in Illinois. And I have personally been on calls with Vice President Pence and in meetings with governors from across the nation, and I have spoken with the CDC and with other health experts to monitor COVID-19 at the state, national, and global levels. Additionally, following the recommendation of the CDC, we are running voluntary surveillance testing at 7 hospitals in Chicago and Cook County, 2 hospitals in other areas of northern Illinois, 1 hospital in southern Illinois, and 1 in central Illinois to monitor for the presence of the virus in all of our communities. IDPH is in the process of confirming additional surveillance at hospitals statewide. We've also been coordinating with the Illinois State Board of Education to ensure that every school district in Illinois is operating with the best guidelines and protocols as this situation evolves. If you think you might be sick, please take no risks that could endanger others in the community. Call a health provider to plan a safe visit to the doctor if you're experiencing any symptoms. Our Illinois Department of Public Health has a statewide COVID-19 coronavirus hotline and website to answer any questions from the public or to report a suspected case. That phone number is 1-800-889-3931. Again, 1-800-889-3931, and online at dph.illinois.gov. We are here to help. I want to thank the mayor and her team for working so closely with our state officials, with county officials. It's really been a great relationship, and frankly, they're doing a terrific job at protecting the people of the city of Chicago as we are working hard to protect everyone in the state of Illinois.
Thank you. We'll take any questions that you might have.
So she has been working at the school since coming back?
She came back, and I believe reported to work on in the week of the 25th, expressed some symptoms, and then her last day of work, I believe, is on March 2nd.
Are there any?
If it can take 14 days to show symptoms, why not cancel classes for 2 weeks?
I'll take that.
I'll take. Go ahead.
If you like.
Yeah.
So this is exactly what we're looking at. So where we consider limiting exposures is from the last day of exposure. The last day that this teacher was at work was on March 2nd. At the moment, that is the only case that we have. And so if we do not identify any additional cases, 2 weeks from that would be March 16th, which means closing school next week. If we identify additional cases, of course, we would adjust that as needed, but that is using the most up-to-date science and the current recommendations.
At this particular time, with this case at CPS, are you considering putting any restrictions on staff members and/or teachers as to where they can and can't go, considering you have spring break coming up in just a few weeks?
Yeah, earlier today, we, before this was confirmed, we announced travel ban. So we, any school-related travel to level 2 and level 3 locations have been canceled, and we also encourage employees strongly to cancel any personal plans. Should they continue on to destinations that are in the level 2-3 category, they will be directed to self-quarantine at home for 14 days after they return. So that is the guidance that went out this afternoon. So as of now, everyone is aware, and we also contacted the schools directly that we knew of that had travel set up already.
Back there.
Dr. Arwood, do you know, or the mayor, how many people you're tracking in all this, the students plus the family and others who may?
Yeah, so it would be premature to give a specific number at this point. We will be reaching out, and we'll be working with CPS to reach out to all students at this school, as well as all employees at this school. My team has also already begun working to make sure if there are any additional exposures that we need to investigate or reach out to, we will be doing that. So I don't have a specific number at this time, but as we have been for all of these cases, we will be broad in our investigation and make sure that we are identifying anybody who is at risk, monitor where is appropriate, and then test where it is indicated.
So her last day was on,
We can get you
March
those exact
2nd.
numbers.
What hospital, when was she hospitalized, and what hospital is she at?
Well, we're not going to be giving out the name of the hospital at the hospital's request. Obviously, as you know, we want to make sure that while we're providing as much information as possible to the public, but we want to be respectful of her privacy rights. We can tell you that she is getting hospital care, her condition is stable, and if there's any change in that, obviously we'll update you accordingly.
Was she hospitalized that same day, the day that she stopped working on March 2nd, or was she just recently
I don't know if we know
hospitalized?
that.
Yeah, so I don't want to get into a whole lot of the details of the case while we're working on this investigation. I can tell you that when she learned about the cruise ship situation, which was announced on the 4th, and then in particular, the Chicago Department of Public Health received notification sort of through the CDC, through our, the federal mechanism, that we had a patient here in the Chicago area who had been on this cruise ship. In that setting, we reached out to ensure that the patient would be appropriately tested, and that's where we are.
Respecting the privacy of this patient, what about that individual's family? Does she have any family members at home with her? And is there a possibility that any of those that live in the home with her could have taken this? Are you letting their workplace and/or school know about the concerns that this could spread further than just Vaughn High School?
Yeah, so again, at this time, we're working on the details of that. I can tell you that if she has any family members at home, they would be home quarantined.
Can you describe the nature of her work as a special ed assistant? Did she work in a classroom, multiple classrooms? What kind of work specifically was she?
We're getting that exact information. I don't want to share more information here. We need to talk to the parents first, but essentially a special education classroom assistant would work in the classroom with teachers and students every single day. They would support students during instruction, but also support them to and from other locations in the building, such as the restroom, the lunchroom. Some of them do assist with feeding and other needs of the students.
And what is the student population and faculty population if you're reaching out to every single?
We will get you the exact numbers, but it is a small specialty high school for students with disabilities, so this is a vulnerable population. We do have many students that are medically fragile in the school, but we'll get you the exact number at the conclusion of this press conference.
And when exactly did you find out about?
Student number is 212.
212. Thank you, Doctor.
And when exactly did you find that this person tested positive? Was it today that you found out?
Today.
Today.
An hour ago.
Do you know how many faculty?
I do not know. We will find that out, and we will get it back to you.
Could you talk about the state supports that you'll be offering? Is this going to be insurance help? Is the state going to cover the cost for all these tests?
So first of all of the tests are free. And we've made that clear. We've also spoken with the insurance companies, the largest insurance companies in the state of Illinois, to make sure that they are offering the care that is needed, not only by the people who are fully insured by their companies, but also those that are underinsured. We're also encouraging companies to follow Cigna's lead that when these tests are widely available by private labs, that they would be fully covered by insurance companies in the state of Illinois. So we're working hard to make sure that there's coverage for everybody. Of course, there's coverage for those who are part of Medicaid. And in every case, we're going to be providing support to counties and cities where there may be a situation. But I do want to remind everybody, this is the 6th case in the state of Illinois. And again, while the risk is low to the public, we are paying very close attention, and we've made preparations for all eventualities. But in a population of 12.7 million people in the state, we are, we're monitoring it closely, but I do think that 6 cases is a good number to focus on. We're monitoring others. You've heard, just people who've been exposed, people who are self-isolating and so on. But at least so far, we're in a good place and doing everything we can.
Do we have a number on how many people are being monitored in the state?
Dr. Zika, do you?
286.
Yeah, the numbers change every day as people fall off their 14 days and new people are added. So we are in the over 250 range. I can't give you the exact number because it's changed from whatever I heard this morning.
Last question. How many tests are still available in the state currently?
That's a great question. So I did check with the lab, and we have enough capacity to test anybody that might be associated with this situation.
Are passengers still being screened at O'Hare, and will you add more countries like Italy?
They are being screened.
Yeah,
Which
so the decisions around screening at O'Hare and at all airports are made at the federal level, and so we do have Chicago Department of Public Health staff on site to make sure that information is being distributed. But at this point, the federal screening that is occurring is happening for passengers from China and from Iran. So we've been using a lot of other mechanisms to make sure that that information is getting out widely for other travelers from those risk 3 areas, which would include Italy, but also South Korea. One other thing that I didn't mention earlier, but I do just want to please remind folks to go to chicago.gov/coronavirus for all of the latest local updates here in Chicago. We are updating that website multiple times a day. We have a lot of guidance on there for individuals. We'll be putting information as is appropriate related to this situation as well.
And to be clear, those students at Vaughn High School, they are told to self-quarantine? Should they be out and about at this particular time?
So we will be reaching out individually to each of these students. At the moment, really the recommendation is that they stay home unless there is a need to seek medical attention. But again, the health department will be reaching out on an individual level. We'll be partnering closely with CPS to make sure that we're very quickly getting the word out to each individual family, because we know that this has the potential to raise a lot of concern. And I want to really reassure folks that we want to have conversations with them on an individual basis. I want to know in each of these cases, my team will be asking the students and their families about any underlying conditions that these students will have. We'll be doing a good analysis of any symptoms that they may have. We'll be sharing guidance around making sure that they are staying home, being able to get some of that good information out. And then where it is appropriate, we will be arranging to test them at no cost to them. And as always, we literally are up here an hour after learning about this test. We've been very clear that we will announce any confirmed test publicly. And I would ask to not have rumors and speculation. I know that there's the potential for that when we're talking about situations that are, near Chicago and in Chicago. But we will confirm in very short order if we have any additional confirmed cases, and we will make any adjustments to the plans that are needed at that point.
So there's